Thank you very much, ma'am, Master of Ceremonies. I think you have to bear with me. I'm from the southern part of the country. So where I come from, sense of humor is something that always has to come with the territory. When we commenced these proceedings, we started with a prayer, and I was reminded of something that when I was growing up, I'm actually a staunch Catholic. I had an ambition of becoming the first black pope. But I just learned whilst I was still entertaining that ambition of mine that when you are a priest in the Catholic setting, you can't afford to get married. In fact, you have to be celibate. So it was quite a tough one. That's why I guess I'm no longer a pope. Now, I think I have to start first by passing my respects to all the guests in this room. I am a legal practitioner, so I've spent, I think, almost half my life doing public speaking, but when I came here, I think I was struck with a lot of anxiety because I was told I'm going to meet the ambassador of the United States. So you have to be very organized when you are in a setting where you are with such a high-ranking official of such an esteemed country, I guess, and I'm quite certain you will agree with me. I cannot also help it but be humbled at the tremendous impact that my colleagues at the MNN Center for Investigative Journalism have had, not only in the media fraternity, but also in playing an efficient and meaningful role in sensitizing our society on many fronts. This I say mainly because this organization is extremely young, with limited resources, but with officials whose commitment is marvelous. It will also obviously be remiss of me if I were to ignore the wonderful friend of this country, the United States of America, and all the efforts that this wonderful country and beautiful country for that matter has had on this equally beautiful mountain kingdom. Now, the burden of HIV and AIDS and its prevalence in Lesotho is something that forms part of debates both in government circles and also in social circles. And it is clearly a cause for concern even globally. We have been called here today, as I understand it, or as I have been made to understand, to debate and perhaps discuss the role played by PEPFAR in Lesotho's HIV, AIDS, and AIDS response in partnership with the Ministry of Health. The desired end, as I understand it, is to implement patterns which will help this kingdom to maximize its efforts in the preventative measures and control of the epidemic. Now, there's a saying that goes in this country that says, I don't know whether it's also quite prominent in the United States, that if HIV and AIDS were either affected or affected in one sense or the other. And I can not help it but speak of my very own experience where almost 12, if not 15 years back, I lost a beautiful aunt whom I loved to the pandemic. And she left behind two beautiful children who effectively, by default, or the resultant effect of which was the burden to my family. So this goes to show that if in one sense you are not affected, in one sense you are infected. So this is clearly an issue that warrants us to debate and canvass, perhaps consistently. We have also been called to discuss and perhaps elaborately debate the underpinning challenges and progress made by this beautiful kingdom in the control of the epidemic and the attendant strides made by our country towards the UN AIDS 90-90-90 targets. I understand and perhaps learned that in the year 2014, the joint United Nations program on HIV and AIDS, that is UNAIDS, and partners launched these targets, which is a program aimed at diagnosing 90% of all HIV positive persons providing antiretroviral therapy for 90% of those diagnosed, and also achieving the viral suppression for 90% of those treated by the year 2020, which is hardly a year from now. The desired end, as I understand it, is to utilize this moment to ask the government functionaries invited here and our partners to motivate the media fraternity to continuously provide coverage on issues touching on HIV and AIDS, and also to demystify the myths and stigma that consumers of news are not very keen on following, especially when one talks of the pandemic. The desired end is to further unpack how the media fraternity remains an important partner in the sensitization of society on the HIV and AIDS related issues. We want, at least in the ultimate end, to educate the Lesotho society on preventing mother-to-child transmission, PMTCT, HIV testing and counseling services, HTS, voluntary medical male circumcision, facility and community-based care and support, pre-exposure prophylaxis, post-exposure prophylaxis, TB, stroke, HIV, pandemic, pediatric treatment, priority populations, and also adult treatment, among others. We want all the desired ends, as I understand it, with this initiative, is to explore and navigate around the notion of what needs to be done for this country to turn the tide against the fact that we are heavily affected by this pandemic. Now, with these few remarks, ladies and gentlemen, I want to state that speaking for myself and coming from the legal fraternity, I have clearly noted significant strides on the legislative front. I know of one law passed by the National Assembly or our legislature that makes it a felony for anyone to deliberately infect another with the HIV and AIDS pandemic. I am also alive to yet another law that renders the discrimination of an HIV AIDS affected person as an unfair labor practice. Now, these initiatives, as I understand it, clearly help in arresting the situation, and I am confident that this country, with these strategic partners, the Americans to be specific, can very well address these core challenges that is facing this country. I must state before I rest that it is always humbling to be in this platform. I'm just a guy from Mategi, and I'm finding this environment to be quite sophisticated. And for that, I welcome you all and hope that we shall venture into meaningful debates and discussions. Thank you very much.
To His Majesty King Lesotho III, the Right Honorable the Prime Minister, the President of the Senate, the Speaker of the National Assembly, the Chief Justice, honorable members of His Majesty's Cabinet, particularly representatives from the Ministry of Communication, the Deputy Minister of Health, Bohledi, who will be joining us shortly, and of course our esteemed and resolute partner, the Director General of Health, Dr. Letsiye, who has joined us today, as well as Excellencies, heads of diplomatic missions and international organizations, senior government officials, members of the press and respective media houses here today. And thank you so much, all of you, for joining us. It is such an honor to be here to further solidify the partnership between the United States President's Emergency Plan for AIDS Relief, which we know as PEPFAR, and the media in Lesotho through the Center for Investigative Journalism. And the goal of this partnership is to deepen the conversation on HIV/AIDS, increase the understanding of relevant issues, and ultimately help ensure that this beautiful kingdom turns the tide and reverses the HIV/AIDS epidemic. 2018 marks 15 years of the United States' global commitment to fighting the HIV/AIDS epidemic through PEPFAR. And this year represents 10 years of our support in partnering with our colleagues here in Lesotho. In these years, American people through PEPFAR have dedicated more than $70 billion worldwide and over $384 million in the bilateral response to Lesotho. So what this amounts to is more than 5 billion maloti in Lesotho, 5.5, over the last 10 years. And I'm so happy to tell you all that this year we will be investing 1 billion maloti in this year alone to fight HIV/AIDS, and that includes testing for cervical cancer. Yes, I'm so excited. As you all know, the current PEPFAR program remains committed to scaling up Lesotho's ARV treatment coverage to reach 90% nationally, commencing self-testing for HIV, and expanding more efficient and effective testing strategies and ways to deliver treatment, especially for adolescents and men. And this includes mobile men's clinics, dedicated men's clinics, and adolescent corners. And I've had the privilege to go to these facilities, and I am struck by how impactful they are and how they're making a difference in this great country. Together, we can ensure that all Basotho have the opportunity to develop their very true potential and to live healthy and prosperous lives. Our partnership with the Center for Investigative Journalism and all media partners here is a tremendous opportunity to increase the availability of life-saving information to the public. The influence of media and its power to do good can help us achieve epidemic control. And in all my travels, whenever I meet people across the districts, one of the things that they say is, we wish we had more information. This can make such a big difference. And so what I want to say is that a healthy media can improve the health of the Basotho people in so many ways. There was a former U.S. Supreme Court Justice. His name was Ndate Brandeis. And he had a very famous quote about sunlight being the best of disinfectants. And his quote was that publicity is justly commended as a remedy for social and industrial diseases. And to me, publicity is a remedy for HIV/AIDS. And you, the media, can not only help us fight HIV/AIDS, you can help us win this war. The United States has a long tradition of defending free speech and protecting freedom of the speech. It is the very core of our Constitution. A free and vibrant press, as you all know, is essential to democracy. A free press holds up a mirror to the actions of the government officials. A free press helps call attention to those issues that affect people's lives, whether those people are American, whether those people are Basotho, whether those people are citizens of our world. A free press is a powerful tool, and with that power comes enormous responsibility. Journalists, editors, and publishers, in fact, all outlets, whether they be print, radio, television, or online, have an obligation to get the story right and to hold themselves to the highest professional standards. They have an awesome responsibility to their readers, to their listeners, and their viewers to accurately report the facts. Only then can the public be an informed, active participant in the democratic process, right alongside the very government that serves them. Today's event strengthens the partnership that we have been building with the press here in Lesotho. This year alone, through PEPFAR, we have sent a journalist from Lesotho, Melerato Matekela, to a journalism health communications workshop in Ethiopia, right? We have also sent 2 Basotho journalists, Keiso Mohlobodi, and Rebafilwe Monapula, to the United States for an in-depth training on investigative journalism. It is encouraging to know that these professionals will be joined by colleagues from the Lesotho newspaper, Public Eye, and the Post for a Business of Truth forum in Johannesburg to further hone their journalism skills. So, as I get close to concluding my remarks, I want to commend the dedication of every journalist who seeks to bring truth to the forefront. Being a champion of accountability and transparency can be a thankless job, but it's a noble pursuit that strengthens the nation and its people. So finally, I wanted to thank you for coming today to this event. It is our collective responsibility to use our voices, including the powerful voices of the media, to work together as partners to bring an end to HIV/AIDS, an epidemic that has weighed on this country and the world for all too long. And one of the things that I just love, and I want to ask you for your apologies if I don't pronounce it correctly, but we all need one another. And I can't think of a more beautiful saying than moto ke moto tapa. So, Riale Boja, and thank you.
His Majesty the King, the Right Honorable the Prime Minister, Minister of Health, Mediji, Mayor Gonzalez, I hear she has just left. The Mayor and everyone else from the PEPFAR and the United States of America's embassy here in Lesotho. PEPFAR is our major partner supporting the fight against HIV and AIDS. The support of 18 amounts to more than $80 million. You can see that is a very huge support. Today the support has been in the areas of human resources, for health, doctors, nurses, pharmacists, lab technologists, and data clerks, and many, many others. Among innovative strategies supported by PEPFAR, which the country is implementing, men's clinics, adolescents and young people friendly services, VMMC, PrEP, PMTCT with early infant diagnosis, and index testing. Through the FEAR survey, we are aware that Lesotho is geared towards reaching epidemic control, as UNAIDS states 1990 targets are as follows. The first 90, we are at 77%. The second 90, we are at 90%. And the third 90, we are at 88%. We are forever thankful to PEPFAR for this support, and we see results. Within this 90 targets, we are among countries that truly could reach the HIV and AIDS epidemic control. Now we need to be even more adamant to reach the 95 targets, and I'm confident that we will reach them and eventually reach the 100% epidemic control. As government, our key priority is universal health coverage, and we have started establishing clinics and health posts for the rural communities. Let us all remember that 75% of Lesotho people live in the rural areas, and only 25% live in urban areas. We need to provide people-centered health services that leaves no one behind. As such, we need to thank PEPFAR, which is our main partner, and her implementing partners. And I also want to thank media for making our stories and performance to be known locally and globally. Ke kopa ho bua taba ena hape ka Sesotho bo mme le bo ntate. Ke kopa ka nnete re amohela le ho ananela mosebetsi o moholo o lo etsang ho sekehela le ho beha setjhaba sa Basotho sehlohlolong sa ditaba tse ntse di etsahala, tseo mmuso o di etsang, tseo lekala la bophelo le di etsang, e le hobane ha ho bobebe ho rona ho fihla dibakeng tsohle kapa ho fihlela Mosotho e mong le e mong, empa ka lona bomme le bontate ba baqolotsi le baphatlalatsi ba ditaba tsa rona di kgona ho fihlella Mosotho e mong le e mong hohle moo ba leng teng, mme ho tswa botebong ba pelo tsa rona, ba pelo ya ka, re a le leboha, re kopa le matlafatse tshebetso ya lona, mme ke takatso ya rona also re le lekala hore e ka re ka ba le mmoka o tjena mafapheng ohle moo re le hlalosetsang hore na re ntse re etsang, hobane re a tseba hore ha re le boleletse ditaba tse jwalo di fihla hantle ho Mosotho e mong le e mong hohle moo a leng teng. Ka hoo, thank you very much from the bottom of our hearts as the Ministry of Health and the Government of Lesotho. Thank you very much, PEPFAR.
PEPFAR globally. So PEPFAR is about a $6 billion a year program across 50 countries. Don't know that number in Maludi, but I'll try to use Maludi when I can. So what do we do with that money? Well, in 2003, when PEPFAR started, the ambassador mentioned this morning that we're celebrating 15 years of PEPFAR globally and 10 years of PEPFAR here in Lesotho. So in 2003, when PEPFAR began, there were 50,000 people on treatment. For some perspective, that's a quarter of the number of people on treatment today in Lesotho. And this was global. So PEPFAR began to try to address this issue along with a number of other global partners. Today in sub-Saharan Africa alone, there's 13.3 million people on treatment. That's a huge increase in 15 years. So that is what PEPFAR works day in and day out to do across the globe. So this $6 billion a year is spread across about 50 countries, give or take. Lesotho is one of those countries. So we've got programs in Eastern and Southern Africa. These are in countries with high prevalences and generalized epidemics. So Lesotho would fall in this bucket. Then we have programs in West and Central Africa. These are epidemics with slightly lower prevalences. They can be a mixed epidemic. What I mean by mixed epidemic is it can be pockets within the country that are generalized, and pockets that are concentrated in key and priority populations. We call that mixed. Then we've got programs, apologies for all the different slashes, basically across the rest of the world. In Eastern Europe, Central Asia, Asia, the Caribbean, Latin and Central America. And these are in concentrate epidemics. So these are epidemics that exist in key and priority populations. Last year, PEPFAR set out a strategy for achieving HIV/AIDS epidemic control, and it really identified 13 priority countries where we're close, and we can do this by 2020. We can reach epidemic control. And Lesotho is one of those countries. So the progress that we've seen in Lesotho to date made PEPFAR and the US government confident that by 2020, Lesotho can reach epidemic control, and that's a big deal. So you can go to the next slide. I just chat, don't feel free, it's fine. So the next one, the picture. Back one. Back one, there we go. Okay, so the global burden of HIV. So to give you an idea of how this funding works and how these decisions are made, so this is a map of the world that's not to scale. Sorry, microphone. This is a map of the world that's not to scale, but based on the burden of HIV. So you can see that countries are bigger and darker green based on the burden of HIV. So you see down at the bottom of Africa, a very large, inflated dark green bubble. What this is trying to represent with the picture is the burden of HIV is disproportionately large in Southern Africa. So you can see Lesotho on this map is very large compared to the size it would be on a regular to scale map. And so, as is South Africa, as are many of our neighbors. And so what this really represents is that these are countries that have an incredible burden of HIV. These are often countries that PEPFAR prioritizes for activities because there's a lot of need. Any questions kind of on global PEPFAR? Those are my only 2 slides talking to it. Anything not clear or? No, okay. Wonderful. Okay, so let's talk about Lesotho, our gorgeous mountain kingdom. So, population of about 2 million, just a tiny bit higher percentage of women than men, and about a third of the population is under 15. So of that 2 million people, there's about 320,000 that are HIV positive. This is both children and adults, combination. We have the highest incidence in the world. This is the rate of new infections. To note, our incidence in Lesotho is down quite drastically from what it was 5-10 years ago. So we are making progress, but it is still the highest in the world. And these statistics are all from the LAFIA, which was done in 2016, 2017 here in Lesotho, to give you the source of these numbers. So our prevalence in Lesotho for adults, age 15 to 59, is 25%, 1 in 4. That is 5 times higher than the average for sub-Saharan Africa. Not the world, but the giant dark green bubble that we saw on the map in the previous slide. It's 5 times higher than the average there. So, to put that in perspective. The prevalence is significantly higher among women than men. For all ages 15 to 49, it gets interesting when you look at the FIA data. They get much closer in the older age groups. So it's really those adolescents and young people where the prevalence among women is much higher than men, dragging that whole proportion to be higher among women. Next slide. Sorry, any questions on the Lesotho epidemiology, which is our fancy word for statistics? I know most of these are very familiar to you guys, but bear with me. So the PEPFAR program. USG simply stands for U.S. government. Apologies, PEPFAR loves its acronyms. So I try to minimize them, but you can already see a number of them on the slide alone. So PEPFAR can be confusing to understand, so bear with me. PEPFAR is a global term, honestly kind of for the money. We've got 5 agencies that implement the actual work for PEPFAR. So when you hear about USAID in Lesotho, that's PEPFAR money, but USAID is doing the work, if that makes sense. So if you hear about CDC, they're not separate from PEPFAR. They fall under our big umbrella, but they're the agency doing the work. Hopefully that helps. I know it's confusing even for those of us who work on PEPFAR. So we've got 5 agencies here in Lesotho doing this. So I've attempted to kind of outline which each one does. We have a Department of Defense program. This has a fairly small annual budget of that roughly 1.2 billion Maluti we have this year. But it's an important program, and they do comprehensive HIV testing and treatment and voluntary medical male circumcisions for our LDF and uniform services. Then we have our Department of State. So they do coordination. So I sit under them as the PEPFAR coordinator. And in terms of actual implementation, we do small grant activities for PEPFAR small grants. So I know 2 months ago now, we had our PEPFAR small grants signing ceremony where this year's recipients received their money and got to go back to their communities to start implementing projects. So these are grants of up to $25,000. What is that in Maluti? Any off the top of your head idea? Anyway, sorry, I try to use Maluti when I can. To go back into small grassroots communities, working with children and communities affected by HIV, doing lots of different activities, often income generation, stuff like that. Then we have the Centers for Disease Control, or CDC as they're commonly known. They are one of the 2 large PEPFAR agencies, along with USAID being another one. So they take a large chunk of the 1.2 billion Maluti. Can't do their budget in Maluti myself, but they take roughly half, and USAID takes roughly half, the others taking very small amounts. So CDC, they do comprehensive HIV testing, care, and treatment. They and USAID share this program, and it's broken up by district. They share the same partner, APEC, to do this HIV testing, care, and treatment program. So whether it's funded by CDC or funded by USAID, the program looks the same. So you wouldn't see differences between Maseru or Loribe, despite the fact that one's a CDC district and one's USAID. Those differences are for our own internal budgeting processes, not for on-the-ground program implementation. So what else does CDC do? They take the lead on the TB program. They take the lead on our strategic information. So this would be DHIS2 and the health information system here in Lesotho. This would be your electronic medical records. This would be the LAFIA and other surveys and surveillance activities happening in Lesotho. CDC is also the lead on laboratory work, working closely with the Ministry of Health and URC, another lab partner, on that. I have a slide later where I talk about the partners and their activities, so I won't repeat myself too much. Then we have Peace Corps. I used to be a Peace Corps volunteer a long time ago in Cameroon, so Peace Corps is very near and dear to me. But we have volunteers working on health programs in all 10 districts of Lesotho. They do mostly work with adolescents and young people in their communities on HIV prevention, behavior change, and knowledge building. And then last but certainly not least is USAID, our other large agency. So like CDC, they are the other lead on HIV testing and treatment and suppression. They are the lead for our VMMC program. They are the lead for our work with orphans and vulnerable children. They are the lead for supply chain management. And they are the lead for our project kind of building human resources for health, our work with the nursing program here in Lesotho that happened, and some mapping of human resource needs across the country. Any questions on that? Okay. Historically here in Lesotho, really up until the start of last month, PEPFAR had a lot of activities that were focused geographically in the 5 lowland districts. You'll hear a lot of people talk about PEPFAR priority districts. That's kind of a term of the past now, which is actually fairly exciting for us.